Secondary immunodeficiencies. These arise from acquired suppression of the immune system. Therefore, the immune system impairments that occur mostly due to external factors, which include number one, infections like HIV/AIDS, in which the virus directly targets and depletes the CD4 T cells, leading to severe immunodeficiencies. HIV virus infects the CD4 T helper cells, which are central to activating both cell-mediated and humoral immunity. So the virus enters the CD4 cells, integrates into their DNA, and uses the host machinery to replicate, eventually destroying the cells. As the CD4 count drops, the body becomes increasingly vulnerable to infections. Number two, malnutrition. Severe malnutrition can impair immune function due to deficiency in essential nutrients needed for immune cell function. Malnutrition, especially protein energy malnutrition, affects number one, thymus size function, which leads to decrease in T cell production. Number two, phagocyte function. Number three, cytokine production. Number four, complement proteins, which are partly liver synthesized and nutrition dependent. And number five, antibody production, especially the IgA in the mucosal immunity. Other micronutrients deficiencies that affect immunity include zinc, which impairs T cell maturation and function. Number two, vitamin A, which maintains mucosal barrier integrity and antibody response. Number three, iron deficiency impairs neutrophil activity and T cell function. Number five, vitamin D modulates both innate and adaptive immunity. The third, secondary immunodeficiency, medical treatments. For example, chemotherapy, which is a type of cancer treatment that uses anti-cancer drugs to kill or stop the growth of rapidly dividing cells. So chemotherapy targets and kills rapidly dividing cells, including the immune cells, e.g. the neutrophils and the lymphocytes. Killing of immune cells like neutrophils and lymphocytes results into number one, neutropenia, in which the number of neutrophils that are responsible for bacterial action reduces in the body, and this increases the risk of bacterial infection. Number two, lymphopenia, in which there is reduced count of lymphocytes in the body, and this leads to impaired T and B cell response. So the T cells directly destroy infected or abnormal cells. Number two, help activate other immune cells and regulate the immune response, whereas the B cells are responsible for antibody production. Number three, mucosal damage, which leads to easier entry of pathogens into the body. So the normal mucosal function, the mucosa, the lining in the mouth, nose, GIT, genitals, and others, acts as a physical barrier and immunological barrier. The mucosa secretes mucus, which traps microbes and contain immune cells that kills or neutralize invaders. So when damaged by either chemotherapy, radiation, or infections, it makes it easier for pathogens to penetrate the underlying tissues more easily. And this leads to local infections, e.g. oral thrush or systemic infections. Second example of medical treatment is radiation therapy, also called radiotherapy, which is a medical treatment that uses high energy radiations, usually X-rays, gamma rays, or charged particles, to kill or damage cancer cells. However, in the process, they also destroy bone marrow stem cells, which leads to decreased production of all immune cells. Number 2, damages mucosal barriers and lymphoid organs. And this leads to broad immunosuppression, especially with the total body irradiation. Thirdly, immunosuppressive drugs used in number 1, organ transplantation to prevent rejection. For example, calcineurin inhibitors, e.g. the cyclosporins, which suppress T cell activation. So calcineurin inhibitors are a class of immunosuppressive drugs that are primarily used to prevent organ transplant rejection and treat autoimmune diseases. So they work by inhibiting T cell activation, which plays a very important role in immune response. So calcineurin is a calcium-dependent phosphatase enzyme found in T cells. It activates the nuclear factor of activated T cells that moves into the nucleus and promotes the production of interleukin-2, which is essential for T cell proliferation. So by blocking interleukin-2, these drugs prevent T cells from multiplying and attacking the transplanted organ or causing autoimmune inflammation. The second condition is in autoimmune diseases, which involves overreaction or misdirection of the immune system, where the body attacks its own tissues. To control this, patients are often treated with immunosuppressive drugs, which help reduce inflammation and prevent further tissue damage. However, the same drugs can lead to secondary immunodeficiency. For example, corticosteroids, e.g. prednisone and dexamethasone, reduce inflammation but suppress phagocyte and lymphocyte function. Number 2, inhibit cytokine production. For example, interleukin-1 and interleukin-6 suppress T cell activation and B cell antibody production. And number 3, inhibit phagocyte function, majorly neutrophil migration and killing. The fourth category of secondary immunodeficiencies is chronic diseases. For example, in diabetes mellitus, high blood glucose impairs neutrophil chemotaxis and phagocytosis. Number 2, cytokine production. Number 3, wound healing. And this makes patients prone to skin and urinary tract infection, fungal infection, TB, and other bacterial infections. Secondly, under chronic diseases, we have chronic kidney disease, which causes uremia that suppresses T cell and neutrophil function. The second chronic disease is chronic kidney disease, which causes uremia, a condition that occurs when urea and other metabolic waste build up in the body due to kidney failure. This suppresses T cell and neutrophil function. Third chronic disease are cancers, mostly hematologic types like leukemias and lymphomas, impair immune cell production and function. So bone marrow infiltration and chemotherapy further reduces immunity, hence high risk of opportunistic infections. Number 5, under secondary immunodeficiency is aging or immunosenescence. Immune function naturally declines with age, leading to increased susceptibility to infections and diseases. So what happens to the immune system with age? Number 1, thymus atrophy, in which the size of the thymus reduces. Thymus is one of the lymphoid organs where we have T cell maturation. Therefore, this leads to decreased production of naive T cells. Number 2, reduced B cell function, which lowers the quality of antibody response. Number 3, weakened mucosal barriers. Number 4, chronic low-grade inflammation. And number 5, poor vaccine response, which leads to increased frequency and severity of infections. Number 2, increased cancer risk. And number 3, greater risk of autoimmunity and poor wound healing.